When we have cataracts, basically that lens that we're born with is getting cloudy and it's blurring that vision or causing problems with bright lights or glare. Now that procedure, all we're doing is we're going in, opening that outside shell of that lens, cleaning out that cloudy center part, and then we're going to put a new lens in. Now you'll hear people talk about a lot of different options, different technology that we can consider during cataract surgery. Even though some of that technology is phenomenal, none of it's perfect. And it really boils down to 3 different options that we can consider as far as those different lenses, different technology to try to get that vision better afterwards. The first option is what we call basic cataract surgery. Now, the beautiful thing about that is insurance covers the majority of it. We do use a blade to make those incisions, open that shell of that lens we're born with, and clean out that cloudy center part. And then we use that basic lens that insurance covers. So that strength of that lens does a beautiful job at distance. The downside of that is, even though its strength is at distance, it doesn't minimize any astigmatism to bring that distance into focus. And it also doesn't do anything for up close. So the beautiful thing, insurance covers the majority of it. Downside is we're just gonna need those glasses everywhere afterwards. The second option is what we call custom vision. Now that goal is to get you the best distance vision your eyes are capable of seeing. So minimizing any astigmatism, we use a laser to make all those incisions, take care of that cataract, soften that cloudy center part, and the lens we use to help try to minimize any astigmatism, get that distance as sharp as possible with a goal of decreasing that dependence on those distance glasses. Downside of that one, we still need glasses for up close. So that goal, great distance vision, needing reading glasses for up close. The third option is what we call advanced vision. Now the goal of that technology is to give us great distance, intermediate and near. The least dependence on those glasses. Remember I said none of them are perfect. So where does that fall a little bit short? Even though it gives us very good near vision, it's still very dependent on good lighting. So if you go into like a restaurant with dim lighting and a menu with the colored background faded in, it's still gonna be a little bit tougher to read that than if we've got really good lighting and a white piece of paper with black ink. Also, that lens, the way it's designed to give us that full range, it can cause glare halos around lights. If we fall into that small percentage that knows that, that typically fades away after 3 or 4 months, but it's still very important to realize that's one of those places where that lens isn't perfect. The best vision afterwards, no matter which lens we choose, is always going to be with those eyes together. And what I mean by that, if I've had cataract surgery, and let's say I went with, even with that most advanced lens to give me that best vision at all ranges, if I cover up one eye, I'm going to say, hey doc, that doorknob over there is still a little bit blurry. Okay, cover up this eye, it's still a little bit, that's a whole lot better. And that's because our brain takes all those data points from both eyes, merges that together for that best vision. And so that's irregardless of which option we go with. The most important thing though, with all those different options, even though there's a lot of different technology, it's most important that when we're doing all that screening, that we figure out which options are safe for you to consider, and that you and I spend time going over those pluses and minuses so that when you walk out the door, you can say, hey, here's where I'd like my vision to be in the end. Here's what option has the best chance of getting me there. Now, what are the pluses and minuses, and am I okay with those if I fall into that small percentage? And that way you can kind of walk out and decide what's best for you. I'm Dr. Drew Hunter with Carolina Eyecare Physicians. Thank you for watching, and hopefully you gained some valuable information. Hope you have a blessed day. Again, if you need us at all, please don't hesitate to give us a call. Thank you.